wish I could tell you about just one, because there are unfortunately so many, but one that stood out to me was a woman who came in, and for 15 years she had been managing heavy, painful periods herself. She built her life around it. She worked from home 1 week of the month. She didn't plan vacations when she was on her period. But now that she was in the perimenopause and her periods had become a little more irregular, she was distraught because she didn't know how she was going to cope. I think when she told me, no one has listened to my story. And also when she said, look, I understand that this is just what a period is and that a woman's life is suffering. And I said, no, it doesn't have to be this way, and there are things we can do to help. I think what was missed was the significant impact that her symptoms were having on her entire quality of life, despite multiple clinic visits. And we know that often women's voices, particularly around symptoms to do with their health, are dismissed or not taken seriously, and very often they are reassured rather than being investigated and treated. I think it made a huge difference because she said it's the first time I felt listened to, and then we were able to take steps to ensure that we validated that this is not normal, that it is affecting her life. We investigated her and we made a treatment plan that will hopefully really improve her quality of life. I would say that you know your body best and you know how this is affecting your life. And our job is to investigate and either treat it if we can, or if we can't, treat the source, because modern medicine hasn't identified everything yet, then we can at least help you manage your symptoms. I'm really interested in systemic bias and how that affects patients, not just women who may present the same as a man but are not taken seriously, but knowing that can be compounded by factors like race or culture. I feel very privileged to have been able to work in humanitarian settings. And I think one of the things you learn in resource-poor environments is that we may not always be able to offer investigation and treatment, but we can always listen and bear witness to what they're going through.